Hello, I'm Dr. Uchechi Onodem. I'm here to give an oral presentation on cleft lip and palate, week 1 online course revision. In this week, we had several lectures and we learned several fundamental things about cleft lip and palate. It's a congenital anomaly that is characterized by cleft of the lip and or palate. It's said to be present in 1 in 700 live births. Its prevalence is said to be highest in the Mongoloid race and least in the Negroid race. It's also said to be higher amongst males than in females. However, isolated cleft palate is said to be higher in females than in males. It is classified as either syndromic or non-syndromic, bilateral or unilateral. Syndromic clefts are said to be associated with several syndromes such as Treacher-Collins syndrome, Peter-Alcohol syndrome, Stickler syndrome, Down syndrome, Pierre-Robinson syndrome, and many other syndromes. So when cleft lip and palate is identified, it's always wise to check, examine the entire body for other features because it just might be syndromic. The etiology of cleft lip and palate is multifactorial. It has both environmental factors and genetic factors. Environmentally, it's said to be associated with several risk factors such as smoking, alcohol intake, drugs such as anti-epileptic drugs, also maternal nutrition, that's folate deficiency, vitamin B12 deficiency, have also been associated. Maternal illnesses, maternal asthma or diabetes, obesity have also been associated with an increased risk of cleft lip and palate. Genetically, several genes have been isolated to be associated with cleft lip and palate. This might differ from one race to another. Amongst the genes isolated include IRF6, MTHFR, MSX1, TBX22, and several other genes have been identified. These genes were identified using several methods: linkage method, GWAS, whole genome sequencing, and several other methods have been used to isolate these genes in several studies that have been carried out. However, there's been a problem with identifying a particular cause of cleft lip and palate, basically because of the clinical heterogeneity of the disease, genetic heterogeneity also, the incomplete penetrance, and the complex inheritance, amongst other causes. We also visited the management and stated clearly that it had to be multidisciplinary, involving the ENT surgeon, the oromaxillofacial surgeon, pediatrician, speech therapist, psychologist. All hands have to be on deck for the repair and the rehabilitation of this patient. Also, genetic counseling is said to be really important for the parents of these patients. It's also necessary to plan pregnancies because these nutritional deficiencies that have been associated strongly with cleft lip and palate are said to have the most effect in the first trimester when the face develops. That's the 4th to 12th week of pregnancy, and so it's advised that women in childbearing age should be on supplements, folate supplements, and vitamin B complex supplements. Vitamin B supplements, B12, B9, B6 are all important. Basically, have a healthy nutrition and try to have a healthy pregnancy and stay away from other risk factors. This week has been very informative, and I am really grateful for the lectures. Thank you.